Everyone, it's Frances Reaves, President and CEO of Parent Your Parents, and today I have the privilege of having as my guest Dr. Shaun Corbett, who oversees Miami Jewish Health's clinical programs of everything. This includes working closely with physicians, nurses, caregivers, as they say, to provide an unmatched continuum of care. And I can speak personally to that because I think they do. Dr. Corbett actually focuses on building clinical pathways for patients and residents, the people who live there, that allow them to benefit from a high level of physician interaction, which studies show elders really want. So, Dr. Corbett, welcome. Welcome to our show.
Thank you, Frances. Thank you very much. Thank you for having me.
Well, it's a pleasure. And I think I'm just going to start off by asking you, what does it mean to be Chief Medical Officer at Miami Jewish Health? I mean, that sounds like Atlas, going up that mountain.
Sure. No, it's first it's an honor and a privilege to work in such a wonderful organization and to care for the individuals that we do across our continuum. As Chief Medical Officer, I have oversights from a clinical perspective of essentially all of what we do clinically on campus, all the way ranging from our independent living to our assisted living, our acute care hospital, our nursing home where we do skilled nursing as well as long-term care, and inclusive of our PACE program, where we manage roughly 1,000 individuals in the community and manage all of their medical needs.
Oh, I don't know. That seems like a lot.
It's quite a bit.
It is. I've been on that campus, and it seems to me like you've just taken it on. And so tell me about a normal day for Dr. Corbett once he lands on the campus of Miami Jewish Health.
Well, the interesting thing, Frances, is that there is no normal day. So every day is different. This is clearly not a job that I take lightly, nor one that I can do by myself.
Mm-hmm.
So a lot of this comes to the team that I work with, all of the administrators, as well as those that are delivering the care, the certified nursing assistants, the nurses, the physicians, the nurse practitioners. So this is a team effort. My day typically starts around 7:30 or 8 in the morning.
Wow.
And we go through various meetings and run through our clinicals in the nursing home, and from there it varies. There are different meetings, and sometimes I also see patients myself. So coordinating our clinical efforts, building our pathways. So each day is different, but each day is unique and rewarding.
And so explain a pathway. When you say a clinical pathway.
Sure. So a clinical pathway can mean different things depending on which setting we're referring to.
Mm-hmm.
For example, if we're looking in our skilled nursing facility, we have a dialysis pathway. So we can take individuals in the hospital who may be there for one reason or another and then get discharged to the skilled nursing facility, and we have our dialysis pathway. So we're able to get them in, look at certain labs, have teams that can look at various individuals and meet their needs clinically, and then meet those in terms of different pathways, respiratory pathways, infectious disease pathways, renal pathways, etc.
So pathway is really about the person's, not necessarily disease, but medical issue.
Sure.
That would be their pathway.
Absolutely.
Okay. Now, I love how in the introduction and in all my conversations with Amy and Leah and the people at Miami Jewish Health, you all use empathetic care. I'm a lawyer and I can't even say it right. So empathetic care. So how do you define that term?
Sure. So empathic care.
Oh.
I almost said it wrong myself, but empathic care.
Empathic care. Okay.
So empathy, great question. So empathy is something, it's a normal human emotion that we all feel. And what we've done as an organization is try to embody that human emotion and really permeate it throughout the organization in the way that we deal with each other, even at the administrative level, the clinical level, and the way that we deliver care. So empathy is essentially feeling what another is feeling. So training to basically take that deep breath when you're dealing with an individual you're caring for and thinking about where they are at that moment, actively listening to them. And that will help the caregiver then deliver care that meets the needs of that individual at that time.
Mm-hmm. So, of course, everybody's talking about active listening now. It seems to be sort of the new motivational tool and, growing up tool. So when we're talking about active listening, whether it be a CNA, what is that, certified nurse assistant?
Correct.
Or an RN, a registered nurse, right? Or a doctor or a physician's assistant. They go in and then they listen and then they come back to your team and say, Mrs. So-and-so or Mr. So-and-so. I mean, how I just want a real life example because
Sure.
I think that's fabulous.
Those situations occur and those things do. That's kind of considered like an interdisciplinary team where we have different individuals work with a life that we're caring for, and then they come back to the team and discuss different perspectives and how we'll better manage that. But empathic care is more even on an individual level. It allows you to connect with an individual deeper at that moment. It's not even necessarily going back to a team. It's something that we all strive to do, but it's one of those things that as your day goes on, you're busy and people are thinking about other things and what do I have to do next? And let's just take care of Mrs. Smith here. It's taking that pause, that time out, deep breath. Why is Mrs. Smith acting this way at this moment? Let me think about how I can better deliver care and meet the needs and see where she is right now. So it's a different model of care and different mindset.
Oh, well, it is. I don't see that very often in hospitals.
No, and that's technically why we recognize that.
Yeah.
And as a deficit in terms of the way that care is delivered, and that's why we've changed that model and coined that term to help us deliver care differently than you'll see elsewhere.
And is that new to Miami Jewish? Is that something you've started, Dr. Corbett, or they brought you in to deliver it?
So it's an organizational movement.
Okay.
Dr. Marka Gronen, in charge of our behavioral, mental health and behavioral programs.
The Mind Institute.
Absolutely. Yeah. So Dr. Marka Gronen was the originator and the creator of this, and has really kind of been the backbone of this. But organizationally, we all, if anyone in the organization is not enforcing that, then we're not necessarily meeting our goal. So this is something that should permeate through the entire organization.
Well, that's great. And I know when you and I talked a little bit before this, I asked you why you went into rehab, and you said something that I thought was, I don't know why it meant a lot to me, but it did. And you said the reward of rehabilitative medicine is seeing true functional improvement. And I know that, like many people, my parents are now deceased, but one of them did have to go through a little bit of rehab. And I remember thinking, my dad doesn't. I can take him home. I can hire a physical therapist and, all this stuff. And it really, I sort of felt like they really didn't care whether he got better. Whereas with you, it's just so important. I mean, that's sort of how I felt. Now, where does that come from?
So I think it comes from a couple of different things. One of them is just my training and background, and also just from wanting to see people return to their prior level of function. So that's a goal that we have as physical medicine rehabilitation specialists, is seeing people who have had a functional decline, whatever setting that may be. It can be even young folks, or in our conversation here, looking at geriatric individuals who may have had a slip, fall, fracture of a hip, and how do we get them back to where they were prior to this injury? So that can take weeks, it can take months. But I think we're getting the reward of seeing someone return to their prior level of function, prior to their prior lifestyle, living independently at home, is very satisfying.
And when did you decide that rehabilitation was your direction? Because I noticed in your bio you had done some cancer research with Sylvester and worked at Miller as well. So was it a decision that, did you have like a moment where the light went off and said, this is what I'm going to do? I mean, that's how it was for me with law school. So.
Yeah, I did. So in medical school, we rotate. We have opportunities to rotate in your third and fourth year through other organizations. And I did that, the rotation through physical medicine rehabilitation, and it felt the right fit. And it showed me a different side of medicine that I had not particularly seen before. And I found it exceptionally interesting. And interestingly enough, on that cancer note, prior to doing this, I was working with cancer patients in rehabilitation. So folks that had suffered with a functional decline from their cancer or their treatment, the radiation or surgery, and then getting those individuals back to their hopeful highest level of function.
Oh, so you come with a lot of benefits to MJH. I think that's great. Is it okay if I call it MJH?
You sure can.
Okay. Now, also when we were discussing this program, we discussed the PACE program, which I think is really interesting and important. And I'm just going to say what it is because you told me. It's a program of all-inclusive care for the elderly, which is run by both Miami-Dade County and Broward County. But at MJH, you deal more with Miami-Dade residents. Is that correct? Well, why don't you tell us the PACE program and what you all do? I think it's great what you do.
Sure. So you very eloquently described the name of the program. So this program of all-inclusive care for the elderly. One point of correction that it's not necessarily run by the county. We care for individuals who live in those counties.
Oh, okay.
So the PACE
That
program
is
is technically run by Miami Jewish, which
Uh-huh.
was actually the first PACE program in the state of Florida,
Wow.
and the only PACE program today in both Miami-Dade and Broward. So it is run by Miami Jewish, where we care for roughly 1,000 lives in the community, and the goal of the program is to deliver the care. So these are nursing home eligible individuals that we are working to manage them in their current living environment, all of their medical needs from A to Z, and keeping them as healthy as possible and living in the community.
Wow. And so that means you also oversee outward bound type of teams. I'm assuming teams have to go out to these homes and then report back in.
Absolutely. So those are called the interdisciplinary teams.
Mhm.
Each site, we have 4 different sites currently that each has their own medical director. And those sites, we have nurse practitioners, nurses, et cetera, that go to the homes
Mhm.
and evaluate people in their place. We also can bring them into the centers for evaluation, if they need different type of therapy services, et cetera. So it's a mix between the two. Clearly, the pandemic has shifted that to really home-based, where we had to manage most of these folks and individuals in their place of living. But we do have the option and opportunity to bring them into the facility as well as often as necessary.
Well, I really wasn't going to get into the pandemic that much, but when you say that these folks during the pandemic, and you and I discussed this very briefly, just about the fact that we didn't know what was happening. I mean, doctors didn't know, much less someone like me. And so what was that like for your teams as they're going? I mean, this is in the early stages, before we knew what we knew at the end of it. What was it like for your teams? I mean, that had to be, what's that word I can't say?
Empathic.
I mean, that had to be real empathic learning on both sides, both as a professional with a professional and the professional with the team.
I think it's a great question, Francis, and we could probably talk for hours regarding that. And one of the, just challenges was, you stated it very eloquently, that not much was known. So, we worked as a team. I couldn't be more proud of the team that we work with at Miami Jewish in terms of doing and utilizing the information that we knew at the time to best care for each individual that we cared for. In hindsight, was everything perfect with what we did as a medical community across the board? We learned more about the virus as time went on.
Sure.
So I think all in all, I think we did the best that we absolutely could do, and I'm
Right.
very, very proud of the team. I think there's been challenges just across the board in the isolation that individuals have gone through. I think a lot of it's just really been challenging for not only the healthcare community, but for the entire nation and world, for that matter.
Well, I mean, I'm just thinking about that healthcare person who is, I mean, you're the one going to see that person and you want to do all you can for them. But at the same time, you're limited because of what you can give them or what they can give you. And I think that, and I'm sort of speaking off the cuff here, that I don't think we've focused enough, and this just occurred to me. So I don't think we've focused enough on our professionals and their mental health. I mean, I think that has to be a little difficult when you too, your hands are tied And all you want to do is make this person better. And especially through a PACE program where this person is all you have, basically. Am I wrong?
No, that's correct.
And I mean, how you deal with it, not just with the person, your patient, but also with the other caregivers that you're having to, you don't want them to get it. I hadn't, until this moment, I hadn't thought about it. So, but the pandemic is, we sort of think over, the news still delivers new. If you get a vaccine, for the most part, it's over. Correct?
We would think that today. Who knows what the future will tell? But yes,
true,
absolutely.
That's true. So so what's next now that we've sort of come through this? I mean, the good news is, I guess, we know we can. I thought it was fantastic that in 10 months we had a vaccine. I thought, that's so, I mean, we all just came together. Not that the whole world has it yet, but certainly the United States was a leader in that. But now, as a leader of the medical community at Miami Jewish Health, what's next? How do you take what you learned?
Well, I think there's a lot of things to learn. And actually, you brought up one thing I'd like to just touch on in terms
Please.
of the mental health of the caregivers and providers and medical professionals. And I know that Miami Jewish is likely no different than any other healthcare facility in the country. One thing that empathic care helped us through this was thinking about the fear that the individual caregiver was going through. We're concerned about, and they're concerned about themselves contracting the virus, not only caring for the individual, but what happens when they go home and potentially are exposed or bring it to their family. So we worked a lot with that, and our mental health team, led by Dr. Gronin, and our psychologist did meet with employees to the best of the ability and to work through that. So we did consider that. We hoped to address that to help our caregivers better, because if our caregivers are so concerned and nervous about themselves and their families, how can they deliver appropriate care to others? And that's, again, not a problem that's unique to Miami Jewish, but something I just wanted to touch on, that we did consider that. And I think, again, a challenging time.
Yeah.
How do we go forward from here? I think a couple of different things. So one of them, we learned a lot through the pandemic. And one thing, and another thing that you touched on, was the speed of the vaccination. And we've done a lot of work with our employees, with our residents, with the folks that live in our independent living and our assisted living, as well as our PACE, as well as the nursing home, to really encourage vaccination for those that are eligible. And by and large, most people are eligible for the vaccine. I really think that that's how we move forward from a pure clinical and medical perspective in terms of getting back to normal. Who doesn't want to get back to normal, right? So I think, I absolutely lead that, want to get back to that, and vaccination's part of that. So we continue to encourage vaccination. We run vaccination campaigns to encourage continued vaccination. So that's one. Second thing I think we learned a lot about is the value of home and community-based services. So we're going to continue to expand in what we do and how we deliver the care, not only to those individuals that require to be in a nursing home that fit that model, but for those individuals that are living in the community. We will work to continue to expand and deliver medical care, nursing care, et cetera, to individuals living in the community. Third thing is looking at healthy aging, and how do we move forward, and how do we get back to normal and look at healthy aging, look at mental health, look at those folks who suffer with neurocognitive disorders and folks that we can treat in our mind clinic and our outpatient clinics. And lastly is continuing to individualize the care that we provide and finding the right location and treating the right individual in the right location through our continuum of care.
So, and when you say treat the right individual in the right location, that means whether you bring them in to the community versus keeping them in their home?
Correct. If it's someone's safe and they are safely able to live in their home, but have nursing needs or medical needs, we very likely can deliver the care that individual needs to their home. You may have some individuals that don't have any support at home and have medical needs that are beyond what we can deliver safely at home. And those may be individuals who need to live in a nursing home or a long-term care or an assisted living facility. So making the correct judgment in terms of where somebody is best treated is part of our job, and then delivering the care that they need at that location.
And how far does Miami Jewish go with their PACE program? Do you go down to like Homestead, or is that too far, or?
No, anything in Miami-Dade is our general catchment area, so we can go down to Homestead and up and through Broward County as well.
Oh, because Broward County supports it as well. So you have it for both counties? You're the only PACE program for both Broward County and Miami-Dade?
Correct. Today we're the only PACE program for both
Wow.
Miami-Dade and Broward.
And you have 1,000 people. Do you have a maximum of how many you can have in that? What's the maximum?
The maximum, there's a number of slots that are given essentially through an application process through the state that comes through, it's political and also looking at what the needs are in the community.
Sure.
So I think we have roughly 1,200 slots thereabout of individuals. So we're looking to continue expanding our PACE program because it's really a beautiful model of care.
It is absolutely. And when did PACE start?
They started in the early 2000s, at least here in Florida.
Okay.
It's been around for longer in other states, and it's expanding nationwide.
Okay. And it's somebody's brainchild?
That's a good question. I don't know if it was someone's brainchild or if it was a government started, but it is clearly expanding. It is not in all 50 states yet, but I anticipate that it will be eventually.
Okay. And so we've discussed a little bit about how Miami Jewish takes, so much pride, and you with your team on the ability to manage people in the community. And the PACE people are basically nursing home eligible. In other words, they're Medicaid. So they're Medicaid, they would qualify for Medicaid and therefore be able to be in a nursing home. And so what if you don't qualify for Medicaid? What if you're just Medicare eligible? Are there programs that you all do for that as well?
So you're absolutely correct in terms of the vast majority of individuals there are considered nursing home eligible and are under Medicaid. There are private pay options for PACE programs.
Okay.
Currently today, Medicare is not eligible. Where that goes in the future, who knows? But I do know that we can look at the Medicare population, and we do have options and opportunities to continue delivering care through home health care agencies, et cetera.
Mm-hmm.
And we are looking to expand those types of programs and how we can deliver that level of care to individuals in the community who are not necessarily Medicaid, who may not be able to pay privately.
Okay. So through Medicare.
Correct.
Okay. And what haven't I touched on? Tell me a little bit about what you like to brag about when it comes to Miami Jewish.
Well, I think you've touched on a number of important topics today, and we've even touched on pandemic, et cetera, because no conversation in 2021 can occur without a conversation regarding the pandemic. But, I think the unique thing at Miami Jewish that really differentiates us from most other healthcare organizations in the community is our focus on individualized geriatric care and helping people through our continuum of care, which I also think is unique. Again, we have a small acute care hospital. We have independent living, assisted living, nursing home, as well as being able to manage folks Medicare also in the community through our home health care,
right,
as well as our PACE programs. So as individuals age, one of our topics that we frequently discuss is aging in place, healthy aging in place. We know that most people would like to stay at home and age in their own homes. So we're targeting our programs and our focus on how do we allow and how do we help people to do that.
Okay. We didn't discuss this, so but I'm going to ask you anyway, simply because I don't know if I told you this, but I've written a book on healthy aging. Well, actually on having fun while you're old, because that's what I'm doing. And one of the things I've read about in the research that I did for this book was where they put a little, some wellness or these live cities, put a little thing like we do our pets, but it measures your blood pressure and all your vitals. Is that something that Miami Jewish would look at? I mean, you're already so far out there in the community. I mean, is that something, am I way out there?
You are not way out there. Absolutely. So we call that remote patient monitoring.
Okay.
Which clearly in the clinical sense is doing exactly what you indicated, looking at blood pressures, even potentially looking at people's blood sugars for those that are diabetic. So we can intervene earlier as opposed to waiting till someone's so sick that they then have to go to the hospital. We know that hospitals serve a tremendous role in our community, but nobody really wants to be in the hospital, right? So if we can intervene sooner, we opt to do that. So absolutely, we are looking at different ways to do remote patient monitoring, and we will clearly be working on developing those programs in the coming months to years.
Yeah. And do you think it's months or do you think it's years?
I think it's months.
Okay.
It's
because that's how I want to be monitored. I mean, I love the idea of having some. I know it gives up some of my privacy, but Nordstrom already knows everything much more about me than my husband does. So I love the idea of if I've had an issue that I just have something in there that rings in someone's office that says Francis is off kilter. I mean, I kind of like that. I realize that a lot of people, privacy advocates, don't, but that's okay. They don't have to. I'll go and get it put in.
Yeah, and I think it can be, who individuals who choose to have it can have that service, and those who don't have to. I tell people that if you have a cell phone sitting in your pocket or your purse, you're already being monitored and tracked.
Yeah, it's true.
So there's ways to do it productively and proactively to really assist an individual, and I think this is clearly one of them. Is it an option for everybody? Probably not, but I think those who do opt for that, I do think there's technology that will allow us to do that and allow us to do it effectively.
Yeah. Well, I mean, how do you feel about it personally? I mean, would you have, what do you call it, a chip? There are chips and there are different things you can have, but yes, I think personally, I think it's a great tool. I think it's an excellent tool because, again, in medicine, one thing that we've done in the past is be very reactive. And now there's a large push in the medical community to be proactive. So managing people's blood pressures on a day-to-day basis before they become so hypertensive that they have a stroke. Right.
And then you're dealing with the other manifestations of that. So I absolutely think it will be a useful tool, or it is a useful tool, and will continue to become one, and will be even utilized more in the future.
Until today, I didn't know you all had an acute hospital. It's how many beds?
32.
Oh, it is small. Okay. And so I guess it's just something that you go to for an emergency. I mean, I thought I knew that campus so well. That'll teach me. So tell me a little bit about your 32-bed acute hospital. How is it used?
So the hospital's name is Douglas Gardens Hospital. It is utilized mostly to care for the individuals that are living within the 4 walls of our 26-acre campus.
Yeah, it's a great campus.
And essentially, if someone's in the assisted living, for example, and they're just not looking right, for example, we can bring them to the hospital for closer monitoring.
I see.
Which maintains them on campus. They don't have to go to an outside hospital where they'll have a new doctor, they'll have a whole new set of sit in an emergency room for a number of hours. So it can be direct admit. So we utilize it for that.
Oh, that is great. I hate those emergency rooms. I've never understood why we sent older people to emergency rooms. I mean, there's all sorts of things floating around in there. I remember sitting in one for like 3 or 4 hours with my father. And then when they finally put him into the room, it was nighttime. Nothing ever happens during the day. Why is that? Is there a medical reason for that, Dr. Corbett?
There must be a medical reason why things happen on holiday weekends, right? That seems to be when things occur.
And at night. But I do remember I was pretty protective of my dad I was pretty protective of my dad, period. But the truth is, I remember laying on the floor there. And for me, it was really interesting, sort of on an existential level, the fact that here I am laying on the floor, not that anyone cared. They didn't even have a chair that I could sit in next to him. And I kept trying to find blankets because it's so cold in there. I mean, I understand everybody's running around like chickens with their heads cut off, so they're not cold. But I was just freezing. And I remember just thinking, oh my gosh. And Dad, he'd wake up and he'd see me go, Frances, you've got to go. And I go, no, you'll get a room. And I just remember thinking, oh my gosh, how do you do this? How, the stress, I mean, I was under stress, but the stress that an older person has to go through. So the idea that you can go to this campus and the person take you over to the acute hospital, I mean, just on a cognitive level alone, that's so helpful.
You're absolutely right.
I was going to say you should be saying this.
Yeah,
I'm a lawyer.
You said it for me. No, you're absolutely right. And the emergency room is a challenging place for elders, particularly with cognitive disorders. It can be disorienting, but they play a role. Mm-hmm. And you don't want to be in an emergency room unless you need to be in one. And so they clearly have a role. But this comes into the remote patient monitoring. And if we can be more proactive and interactive with our residents and those that we care for, we can hopefully avoid unnecessary ER visits, unnecessary hospitalizations. The vast majority of individuals that we care for, if they end up in an ER, they will likely be hospitalized. That's their baseline.
Right.
So it's an excellent point, and we do our best to avoid emergency room visits.
I think that's fabulous.
And they are, even for those folks who aren't neurocognitively challenged, they're scary, cold places at times.
Well, and studies show, since you're the doctor, you can correct me if I'm wrong, but studies show that when you go into a hospital, the older you are, the more cognitive dysfunction happens. But even if you're 10, you're going to have some cognitive dysfunction just because it's a hospital and nothing is within your control. Right?
Absolutely.
But at 10, you get done with it sooner. That's all.
Yeah, no, I think I think that's spot on. And again, hospitals are absolutely necessary for certain conditions, but the sooner we can get people out of hospitals, when we can avoid unnecessary hospitalizations, that's a win for the individual. It's a win for society.
So, Dr. Corbett, before I end the program, I want your promise that I can come to your hospital. Should something happen to me, I don't want to go to the big hospital.
Well, let's start with a chip, and we'll remote patient monitor so we could avoid the unnecessary hospitalization. But absolutely, Francis, you're welcome to come anytime. I hope to see you socially, but not in the hospital. Okay.
Well, Grant Miller just walked in, so I'm going to say, Grant, don't you want to go to the hospital? And
of course it
show that. It's a great place, without a doubt. Dr. Corbett, I can't thank you enough for coming. This was and me, who's a huge Miami Jewish health support, I love that place. I have a couple clients there. I didn't know about your acute hospital, so now I'm very excited. I'll need your cell phone.
Very good. You're very good, Francis. You can have it. And thank you so much for having me here today. And it's been a pleasure.
It has. It really has been a pleasure. And Tommy, I think we're out. MiamiCommunityNews.com. That's where we do this Facebook Live. And I'm Francis Reaves from Parent Your Parents at ParentYourParents.com. We'll see you soon. Thank you so much.